So once again, we're working as hard and as fast as we can to bring this outbreak in Shepparton under control. We're dedicating as many resources as possible at GV Health to controlling and getting on top of the outbreak as quickly as possible. I'd just like to acknowledge and thank the community, in particular, community members, for being patient and working with us while we progress through the testing locations in terms of the volume of people that we need to test. I'd also like to thank the many organisations from across rural Victoria, different colleagues of ours in health services and other community agency providers that are doing a great job in supporting the testing effort in particular, and in other ways in terms of mobilising the response that we've been able to in the last few days. Yesterday we did over 3,000 tests for people for COVID-19 in our community. There's additional testing that other services are providing, private providers and different contractors, so the number of tests would be higher than that, in fact, that were conducted yesterday. The other thing to note, last night, of course, things took a little bit of a turn in some regards in relation to a confirmed positive case at the school community of Notre Dame College. What that means now in terms of what we're trying to increase from a resourcing perspective is Notre Dame College has, I understand, around about 1,600 students, 300 staff, and then if you add that up with the household contacts of all of those people and their families, we're looking at several thousand people who are also going to need testing. So yesterday I talked about the fact that we were trying to anticipate, in fact, that we were going to need to test around 10 to 11,000 people in the Shepparton community for COVID-19. We now think that's more likely to be in excess of 16,000 people that are going to need to be tested. In that regard, today we opened another drive-through site in Mooroopna at the Mooroopna Recreation Reserve. So now we have 4 drive-through sites in Shepparton, and they're at today, as I said, at Mooroopna, the Shepparton Harness Racing Club, the Shepparton Showgrounds and the Sports Precinct, in addition to the respiratory clinic we have here at Graham Street. Just ask the community to keep up to date with our Facebook page and other sources of information in terms of where we are asking for priority groups to come forward and be testing for testing. We're doing that at the Shepparton Sports Precinct, and the reason, for example, today that we're concentrating on a particular group of the Notre Dame College is that we want to understand as quickly as we can about how the virus is moving through the community. And that's significant because it's going to allow us to get on top of this more quickly than just doing a more blanket, widespread testing approach. We're still committed to doing that, and we will get to the testing that we can in coming days, but we just ask for the community's cooperation in allowing those priority access areas so that we can get on top of this as quickly as possible. I just ask also that people use the Department of Health's coronavirus.vic.gov.au as their single source of truth in regards to any information and advice that you might need. Also has great details about exposure sites, testing locations outside of the Shepparton area, and a range of other information in relation to COVID-19. So, as I said before, we're trying to get on top of this as quickly as we can. We are throwing a huge number of resources at this right now, and we'll continue to do so in the coming days.
Can I just confirm the total number of cases is 36 at the moment?
Yeah, so it's in excess of 35. So yes, I hadn't seen the 36 published, but in regards to the positive cases, we expect that number is going to continue to grow in the coming days. And as I said before, what's really important to enable us to get on top of it is the priority testing for those groups that we're mentioning on our communications.
In terms of, I guess, not knowing where the virus is going at the moment, how concerning is that for contact tracers? So
people should be following the advice to stay at home. That's the best thing that people can do to stop the spread in terms of more broader acquisition in the community. If they actually follow that advice and stay at home. That's something that's relatively simple that everyone can do. In terms of the spread around the school communities, well, obviously the schools are closed now, so that should limit it. So it's now a bit of a tracing and detective type of work that the contact tracers have to do to find those chains of transmission, but that's in addition to the testing that we need to do to find out who may have contracted the virus.
How are we going at testing sites today? Have we managed to get more people in to help with the demand?
Yes, we've had additional resources come in to support the existing testing sites that we've established since Friday afternoon and across the weekend. As I mentioned before, we've received further support from the Department of Health today to establish a fourth drive-through testing site at the Marupna Recreation Reserve, which opened earlier this afternoon.
Do you feel like you're getting, on top of where this came from and where it is going?
It's still, so we're limiting the spread in terms of the public health measures and the like in relation to lockdown and stay-at-home provisions that people are required to follow. In terms of getting on top of it, the contact tracers locally, and we've also got support from other public health units across the state, are working really quickly to do absolutely everything they can to conduct those interviews and talk to the people that have contracted the virus and understand what their movements are in order to be able to post exposure sites, etc., and provide more details.
Police have spoken today about investigating a 500 people strong funeral that may have happened here in Shepparton with a man that tested positive from Melbourne. What are GV's health thoughts on that and what work's going into confirming that? I'm aware that there's been some rumours or speculation about a large funeral, certainly aware of that. In terms of its link to the outbreak locally, I'm not aware of anything that suggests that at this stage. And of course, if the police are involved, it really is a matter for Victoria Police to conduct their investigations and provide comment from there. In terms of the escalation of cases, obviously there's been a big jump overnight. Why is there a particular group or something that's attributed to?
There's another family or two that there's been a number of positive cases in relation to those family groups.
Would you expect that we're going to see similar jumps in the coming days?
It's quite possible as the numbers or as the contact tracers are learning more. It's quite possible that there will be more people testing positive. But again, the really important thing to allow us to get on top of that as quickly as we can is that the priority areas at the Shepparton Sports Precinct are kept clear for testing so that we can direct people to get tested there and we can have that done quickly as possible.
So how many households are there now linked to this outbreak?
There'd be over 10.
Over 10. And how many schools, from those people who have tested positive, how many of those are students at schools?
So I don't have that specific detail in terms of the linkages with households and schools. What I can tell you though is that, the information about which schools are involved in the outbreak is available on the department's website. So there's a mixture of secondary schools and primary schools, and there's also a mixture of people in terms of age range of primary school age, secondary school age, younger adults and older adults that have tested positive.
Is it still a majority of children that have tested positive amongst that 36?
It's a younger group of people that we're seeing in relation to those that have tested positive, yes.
And can we confirm that there's around or slightly less than 4,000 people in isolation?
Oh, there'll be more than that. There will be, as I mentioned before, the number of people that will be in isolation at the moment I expect would be well over 10,000. We're seeking to test at least, as I said before, an estimated of over 16,000 people. So those people should be in isolation. So it's more likely, in that order of about 16,000 or more that at least would be isolating at this stage.
And is all the cases still linked together?
It's my understanding, yes, there is links, but the work's still underway to go back and understand what those links are and then what the initial case zero actually is, and that's the work of the contact tracing team at the moment.
And are they currently still in the Shepparton area? Do you know of any other further incursions elsewhere?
There is, so I'm aware there is a likely link to what's, I understand, being termed a positive case in the Mansfield area. I'm not sure if it's expanded to be a cluster as such at this stage, but we understand that that person has visited Shepparton last week, so believe at this time there is a link.
And what about the one in the Royal Melbourne Hospital that came up yesterday?
I have heard some reports of a link with that outbreak. That's not being managed locally in terms of the person in the Royal Melbourne who's tested positive, but I understand there may be a link. In terms of what that link might be, we don't actually know at this stage.
With the Mansfield case, sorry, that I thought the times, can you just explain that? I believe the times didn't actually match up at all?
So I haven't seen what's been reported in relation to the times specifically, but what we do know is that that person was in Shepparton last week, and we know that there was people in the community at that time who were infectious.
So is there any more testing sites expected to be announced in the next few days?
So I'm hopeful.
In the region?
Yeah. So there are already additional testing sites in the region. So, for example, testing's available at health services in Kyabram, Cobram, Yamurka, Benalla and the like. In relation to additional testing sites in Shepparton, we have requested further resources to be made available to boost the testing effort. That would likely be supplementing sites or sites that are already open for testing, and depending on what happens in terms of that resources, we may consider opening an additional site in the coming days, but I'm just waiting on that advice in terms of what resources are going to be available.
Just with those sites at the other towns, the Kyabram, Cobram, Yamurka, Benalla, those sort of places, are people from Shepparton able to go to those sites to be tested if they can't get into the wait times are so long in Shepparton with that 5 kilometre radius?
So we would encourage people not to be travelling at the moment. I appreciate that people are anxious and they'd like to be tested as soon as possible. There is movement through those testing sites. We do acknowledge that there are some delays in the order of 2 to 3 hours on some occasions, and from time to time some of those sites have had to be closed temporarily from a traffic management and safety point of view. But in terms of where the other testing locations are available, the best advice I can provide people is to look on the Department of Health's website. They've got all of the testing locations across the state listed there.
So is it actually legal? Are people allowed to go to those sites from Shepparton?
Well, I'd have to go back and check the public health orders, but I understand that leaving home to be tested for COVID-19 does satisfy as one of the reasons that you can leave home for.
Okay, even if it's in another town and there's a site closer?
That part I can't comment on, no. But you know, from that point of view, we certainly wouldn't be encouraging people who are symptomatic and have been to an exposure site to be travelling any further distance than they absolutely have to.
How many people have been tested so far since Friday in Shepparton?
I don't have that number offhand available, but I would estimate it would have to be in the order of 8,000 to 9,000 people, but we can find out that information and provide that to you afterwards.
That'd be great. And do you know how many tests you're anticipating between now and say next Friday?
Not that far ahead, but so what we're aiming to hit is around about, with the resources we've got at the moment, in terms of those sites that GV Health are coordinating, I expect that we will be able to test around 3,500 people per day based on what services we're providing at this stage. As I mentioned before, there's also additional testing that's available at the Princess Park Respiratory Clinic and 1 or 2 other locations, Rumballara Aboriginal Cooperative and other sites in Shepparton are also providing testing. So the best spot to find out where you can get a test is the Department of Health's website, which is coronavirus.vic.gov.au.
So can I ask, is it only at the moment, only the persons of close contact and not their household members that you're asking to be tested at this stage?
Yeah, so people who have been to the Tier 1 or Tier 2 exposure sites, that information is available on the department's website in terms of where the exposure sites are listed and whether they're categorised as a Tier 1 or Tier 2. There is information in there that on that website that people can access, and if they're unsure, they can ring the department's advice line, which is 1800, I've got the number here, sorry, 1800 675 398, and that's where they can provide or access someone to talk to in relation to providing them further advice. It's difficult for me, without understanding those particular circumstances, to provide advice on that front.
Like with the school students being listed as Tier 1s, do you want just the students to come forward at the moment, or do you want their families?
So eventually all of the household contacts will need to be tested,
Yep.
but as we published late last night, our initial energy and effort is focused on the students and staff of some certain classes at Notre Dame College that we really want to get good line of sight and understanding about what their status is in regards to being positive or not for COVID-19. Good.
And just, can I ask one more, just on staffing levels at the hospital at the moment, given that you've had Notre Dame come up last night, has that taken out more of your numbers?
Yeah, so at the moment we have approximately 270 staff that are furloughed. That number could well grow now. We've certainly seen an increase in the last few hours in relation to the Notre Dame site that's been listed as a Tier 1 exposure site. That's around, and of that 270, approximately 200 of those people, of our staff, are clinical staff. So it's quite possible that that number will increase, but I expect in the coming few days it will fluctuate to some degree in terms of the number of people that are furloughed because of exposure sites.
Are you needing to bring in staff from elsewhere to run the hospital as such here?
What we've been able to do locally is we have temporarily closed or ceased some of our what we call our ambulatory services. So they're our community health and our clinic, allied health services, dental services. Regrettably, that's not certainly what we would do in normal circumstances, but we're not in normal circumstances at the moment. So we know we've got a range of people that have really valuable skills and experience and qualifications that work in some of those areas that we're able to redeploy into making sure we can continue to provide the essential critical services that the community needs, such as in our emergency department, our inpatient wards and operating theatres, for example.
People are saying different things this morning to different people. If you've been to a Tier 1 exposure site, does your time, 14 days of isolation, does it start from the date you were at the exposure site or the date you found out about it? So
people who are in those circumstances, the two things I suggest they do is check the Department of Health's website and find out when they were at that particular exposure site and what that actually means. They will, in time, be contacted by the contact tracing team, and who will be able to provide them answers to those questions. In the meantime, if they have any other information, they can contact the Department of Health's 1800 number in terms of the coronavirus hotline, and they'll be able to get an answer to that question.
So there's no sort of indication, you're not sure if, say, someone went to the school on Tuesday, an outside contact?
It's very, I can tell you, I'll provide you general advice in terms of where people can access information, but because there's so much variation in individual people's circumstances, I'm unable to provide anything specific in that nature, because it could be misleading, and I don't want to send people off on a pathway that may not be the right pathway.